Hi, my name is Dr. Chrisanna Dobrowolski, and I'm an assistant professor of medicine here at Mount Sinai School of Medicine, and I'm here to talk about lupus today. Okay, so what is lupus and what causes it? That's a great question. So lupus is a type of autoimmune disease, and autoimmune conditions occur when a person's immune system is misguided and begins to attack their own tissues. It can affect any organ system, including the skin, the joints, the muscles, kidneys, heart, lungs, brain, and even other organ systems as well. Lupus does tend to run in families, and there are many genes that have been discovered that contribute to lupus. However, this is not the entire story. There also needs to be a trigger for lupus to occur, and this process is not entirely understood. Triggers can include things such as infection, sun exposure, or even stress, and sometimes the trigger is not obvious. So what are some signs and symptoms of lupus or a flare that I can expect? So some of the signs and symptoms can really vary from person to person. And sometimes they can be even mistaken for other diseases. This can cause, delays in diagnosis and a lot of challenges with diagnosis in many patients. However, some things to look out for include joint pain and stiffness, particularly in the morning, skin rashes, in particular on sun-exposed areas, also, fingers or toes that turn white, blue, or red in the cold weather or in stressful conditions. Fever without an infectious cause, swollen lymph nodes or glands, sharp chest pain, and many other signs and symptoms as well. As you can see, they're quite varied depending on the particular patient. So what are some treatment options for lupus? So thankfully, there are many treatment options now. For almost all patients with lupus, we recommend hydroxychloroquine. The other name for this is Plaquenil. And we've used this now for many decades in lupus patients. And it's been shown to prevent flares, to reduce damage, and is really considered an overall very safe medication. It's even been shown to help reduce symptoms during pregnancy. And most patients are recommended to continue during pregnancy. And depending on which organ system or body part is involved, there are many other treatment options as well. So these include things such as injectable medications and also oral medications or pills. Some examples include mycophenolate or Cellcept, azathioprine, as well as cyclophosphamide and Benlysta. So it really depends on, again, which organ systems are involved and after a discussion with your doctor to decide, how to pursue, which is the best treatment for you to pursue. So in terms of how long to take your lupus medications, so for most patients, Plaquenil or hydroxychloroquine is continued throughout your life. Sometimes we nickname this medication vitamin P because we use it so often. And for the other immune suppressing medications, it really depends on your particular lupus and its course. So once your lupus becomes quiet, and hopefully it does, then some of these medications can be very gradually tapered off over time. But again, it's very individualized, and that's best decided in conjunction with your rheumatologist. So in terms of preventing a flare-up, there are many considerations for this. So once you have a diagnosis of lupus, there are many steps that you can take. So the first thing, of course, is to make sure to take your medications regularly. But aside from this, there are also other very important steps that you can take as well. So one consideration is to protect yourself from the sun. So this includes wearing a sunscreen that's considered broad spectrum. So it protects you against UVA and UVB light, and at least an SPF 30 or above. And avoiding peak hours, such as between 10 a.m. and 2 p.m. is important, and wearing long sleeves and a hat where possible. As well, because stress can trigger lupus, it's important to try and manage your stress as best as possible. So this includes seeking any treatment for depression or anxiety, and patients with lupus are at higher risk of these conditions as well. And also, getting enough sleep. For a lot of people, that's between 7 and 9 hours a night. exercise is also very important. So people with lupus are at higher risk of heart disease, and this is particularly important to help reduce your risk of heart disease. As well, there's been a few studies that show fatigue or tiredness can be improved with exercise in patients with lupus, and that can be a really debilitating symptom for a lot of patients. So specifically, we would recommend at least 30 minutes of aerobic exercise at least 5 days a week. So these are things such as biking or running or even walking is very beneficial. So what services do we have here at Mount Sinai? We really have a pretty comprehensive medical team here at Sinai, which I'm very happy and proud to be a part of. So we have many excellent rheumatologists that treat patients with lupus, but as well we have a whole spectrum of medical specialists here because, as I mentioned, lupus can affect any part of your body. So we have nephrology team, which are kidney specialists, neurology, cardiology, dermatology, ophthalmology, psychiatry, and physical therapy, and medicine and rehab as well. And we all work together. We really work closely with these other teams to ensure that our patients get the best care. And further, when patients sometimes are needed to be admitted to hospital, we have a special team in the hospital that helps to take care of our lupus patients as well. In addition, we're in the process of setting up a specialized lupus clinic, which hopefully will be started over the summer months, and we will have a dedicated clinic just for lupus patients with a multi-specialty team. So there'll be more news to come on that. And if anyone would like to set up an appointment, the general number for rheumatology here is 212-241-1671. So in terms of additional information to know about lupus is that, it is a very treatable condition, thankfully, and there are now many treatment options. Patients with lupus can live long and fulfilled lives. But of course, it can be also a scary diagnosis, and it's not something that you should ever have to go through alone. We have a lot of resources to help you, and we're always happy to help if you reach out to us. So please don't hesitate to do so.